Do food allergies impact all communities in the same way? Not quite. Today we're diving into the unique challenges of navigating food allergies in the Hispanic and Latino communities. From language barriers and immigration status to the cultural competency of healthcare practitioners, we'll explore the roadblocks that patients face and the strategies they can use to effectively advocate for their rights. This episode is produced in collaboration with the Allergy and Asthma Network. Now let's get into it. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
Today we have a very special episode. We're going to be talking about food allergies in the Hispanic community and the healthcare disparities and inequities that exist for Hispanic communities. And we have a guest today that is very familiar with these topics, Dr. Hernandez-Trujillo.
Thank you so much for the invitation. I'm Vivian Hernandez-Trujillo. I am the director of the Division of Allergy Immunology at Nicholas Children's Hospital and the Fellowship Training Program Director. I'm also clinical professor of pediatrics at the Herbert Wertheim School of Medicine at Florida International University. And healthcare disparities have actually been near and dear to my heart as a Latina, even from early on in medical school. I was participating in many health fairs and trying to educate my Latino community from that time. So I've become more involved, especially during the pandemic. It's actually been an opportunity for all of us to learn the degree of the disparities that exist and how we can improve them.
To start with, what are the most pressing healthcare disparities faced by Hispanic individuals with food allergies in particular compared to other demographics?
The reality is, and I say this a lot, unfortunately, we don't even understand. We have the tip of the iceberg, right? While we may think that we can lump all Latinos or Hispanics together, and that's at least a start to better understanding our differences, we know that we are very different because even in diseases like asthma, depending on what your country of origin is, obviously that affects. Many of the disparities include limited health literacy. So not only not reading at a specific level, but even having the resources that they need and the materials in their primary language, which is usually Spanish, but it may be something else. Geographic factors, not having transportation, things like health insurance coverage that we may not be thinking about. But if someone has an immigration status, if they're not a legal citizen, it really does present an issue. And it's concerning. I've had patients who come to me, they don't have insurance, and I understand their concerns. Will you not report this? And I always tell them, in a medical facility, wherever that really is, this is private health information. And I think that reassurance is something that's needed because those are all different factors that do, in fact, lead to the disparities that we're seeing in the Hispanic community.
What's interesting is that the medical privacy. So if a patient comes in their legal status, they're probably afraid, actually, first off, to go to the doctor because they're so afraid of being reported. So they're probably living with their food allergies for a very long time and not really knowing that maybe it's food allergies or what's going on with them. And I wonder, is that like a huge problem to getting that population tested and so that they know what's going on and even access to an EpiPen?
The disparities in things like testing and even challenge, it does all come together, right? And it becomes part of a greater issue. So not only have we not made the diagnosis, but then they're not being treated. So when they come to the hospital, they may be sicker than a lot of other patients. They may have had an anaphylactic episode and they just didn't know. They may not have the proper information because they were never seen by a specialist who was able to speak to them about it.
Can we define the population we're talking about? So when we talk about health disparities, who are we talking about? What is a health disparity and who falls into that category as a patient?
Okay, so healthcare disparity exists because people that should be given like the same opportunity, same treatment, same diagnosis are not. So that's a healthcare disparity. The patients that we're talking about, and this really can be, in some cases it may be related to economic status, but in other cases it may not be, because if you are in a position where you're able to have, let's say, employment that offers you insurance, so that's number one. Not everyone, whether or not your citizenship or immigration status is, it really almost doesn't depend on that, because if you're working in a job that doesn't offer you health insurance, for example, you may not be able to afford to go see a specialist or to seek care that you may feel is absolutely not necessary. So I think that's really the group that we're talking about. The social determinants of health are all important because obviously when we talk about diseases like allergy and maybe not as much food allergy, but as we know, many of our patients will have food allergy and allergic rhinitis and asthma. Depending on where you live, there are factors in your environment that are going to affect you. And I think those are things that we also need to keep in mind.
With health disparity, are we also talking about language? Is that also something like being able to understand and navigate the medical system?
Yes. And that's why one of the first things that I said and I talked about, having someone understand the primary language is important. And I live in a state where there are many Spanish-speaking patients, and it still surprises me that patients feel that they cannot be understood by their healthcare provider. And that is obviously an area of concern because if any of us go to an emergency room or if we're having anaphylaxis and you're not able to express or communicate that information, that really does result in a disparity because you're not going to get the care that you should.
And I think that there are certain measures that are taking place in hospitals and healthcare systems. So I think you can advocate for yourself and ask for a translator. And if they don't have a physical translator present, then there are translator phone services where the hospital has to provide translation services for whatever language you speak. And they should have that available.
Absolutely. And that's something you do need to advocate for yourself, right? Because if you don't know about that, you may not know to do that.
Are there other things that people can advocate for and make sure that they understand the system a little bit better? Because that's really what we want to do today is we want to provide some advice and some guidelines for patients that might be experiencing this. And actually, one of the things that Courtney and I are working on is translating all of our episodes into Spanish because we do have such a large population in the US that speaks Spanish. So are there certain things that you think are really important for people to understand? One is the translating services in clinics and doctors' offices, but are there other things that people can advocate for?
Now I'll speak as a Latina and as a Hispanic, having been to the hospital many times with family members. Having an advocate is important, regardless of the disease, but especially in chronic illness, right? So if we're talking about pediatric patients or we're talking about someone who is just not capacitated, regardless of age, I think that that's very important. So having that advocate with you, and as I tell my patients when they come for the first time, we're here to build a relationship. If you feel that I haven't heard you or I'm not giving you what you need, it is okay to find someone else. And I say that because here's where we're going to talk a little bit about cultural differences, right? There's a lot of, I don't want to be disrespectful. No, you need to be true to yourself. You need to take care of yourself and you need to advocate for yourself. And I'm the first who will tell my patients, if you feel that I am not helping you, please, because one of the things I ask most patients before they leave, do you have any questions? And if I haven't answered something clearly, please tell me what you heard, because that's very important. That communication is the foundation of a sound physician-patient relationship, and that will lead to better outcomes. So I really believe that that is key.
And I love that because I tell all patients that the doctor-patient relationship is a relationship. And if it's not working for you, then you need to think about trying to find another provider. And that's not always easy to do, right? Especially if you live in more of a rural area, you may not have as many choices or the ability to find other providers. So that's one thing. But also now with telemedicine, it's nice because you could find a provider that may not be super close to you, but may be available via telemedicine. And I think that those services are coming up more and more too, that may be able to help this divide.
Absolutely.
Can I just ask you to define what an advocate is? So what do you mean by bring an advocate with you?
So an advocate is any person who will actually represent you and is looking out for your best interest. And that might be, my mom right now is ill and I'm going to all the visits with her and I'm speaking on her behalf or speaking with her. So it's anybody that you trust that can really just represent what you need, what your needs are, and to improve the healthcare that you receive.
And I would like to say that I treat a lot of Hispanic patients because of being in New York City. I personally do speak Spanish, but oftentimes I do see that sometimes families will bring a 10-year-old or a 9-year-old that has some level of English, but they are choosing that person to translate for them. And I think that obviously something is better than nothing. And I think that that's the reason that families do that. And I totally understand that. But a child that's only 10 years old can only translate so well. And again, because I speak Spanish, sometimes, I cut that translation off because I know that I'm probably able to understand everything better than the telephone translation that's going on. And so that is one thing I'd like to bring up because, again, if that's the only resource you have and that's the only person that can speak English in your family, then that might be okay, especially if you're in a more rural setting and you don't have other resources available. But you really have to think through who you're bringing and who that advocate is. Make sure that it's as helpful as it can be.
It's interesting that you bring up that example. When my mom first came to this country, she was in her early teens. And some of the stories she still tells to this day are how she was the healthcare advocate for everyone in the family. Whoever was having a baby, if somebody got burned. It's interesting that you say that. And you're right. The good news nowadays is that we have other options. We have translation services, but I completely agree with that.
And now going back to food allergy in particular. So we talked a little bit about maybe testing, but I want to delve a little bit deeper into that. So there's lots of different types of allergy testing that might be needed for somebody with food allergy. Can you talk a little bit about what kind of challenges you've seen in the Hispanic population?
That's a very good question. So one example, honestly, is the expense. So going back to if they have insurance coverage, and there are insurance plans actually that won't even cover, that make that an exclusion, allergy testing. It may not be many, but I've seen it and it's happened more than once. So that makes it difficult for us to be able to diagnose properly, but it also puts them at a disadvantage. And it does create the disparity that we're talking about. And again, I started early in medical school going to different community fairs, whether it was asthma fairs or just within the Latino community. Sometimes it was held at a church, sometimes it was held at a carnival setting, but I always tried to bring information regarding asthma, food allergy, primary immunodeficiency, and I continue to do these fairs. They're some of them my favorite things to do. And I take medical students with me and residents because it's really nice to give back to the community. It also gives patients information that's accurate, and that gives us power, right? So keeping in mind that without the proper information, we'll never even know, oh, I need to go get tested. I just thought that I should avoid all the food. That's the other thing, all these myths. So I become a myth buster. And that's something that I enjoy doing. Let's break apart the information you have and whether or not, yes, you may need to avoid this food, but maybe not this food. And as we all know, that helps all along, but it also helps prevent further food allergy because the more we avoid, the more likely that you can actually develop the allergy.
And you talked about resources that you take with you to these health fairs. So if other healthcare providers are interested in participating in these fairs and providing that kind of accurate information, especially that's translated in Spanish, where do you get your resources? Have you made them yourself or do you get them from a particular website?
That's excellent. So it's a combination of many different places. Now we have a lot more resources than we used to have. Some of them I created early on. Now we have FAIR, we have Allergy and Asthma Network. Really, there are different resources that we can get. And I find that some are easier from one place than others. And a lot of times I'll tell patients, if I don't have something I need, I'll sit with them and I'll Google and we'll find what we need. I print it and then that's in the office. But at the fairs, it's more bringing resources in Spanish, books, materials, graphics. Graphics are great because that can be understood by many people. It's harder when there's a lot of writing and again, keeping in mind the level of literacy.
Great. And we always like to put resources and we would love to have all of your favorite resources in the show notes so that we can give that to, again, healthcare providers and patients that might be interested.
Perfect.
Can we talk about healthcare insurance coverage and the Hispanic population in particular? What do you find is the situation for this particular population?
So there are patients who are employed and are able to have coverage through their employer. Again, depending on the level of coverage, sometimes many of our testing or treatment may actually be excluded. So that's a red flag. The other part is about immigration status. So many of them will have employment that does not provide any insurance, and that's particularly difficult. I'll give examples. We have families who may not be in this country legally, so the children may be on Medicaid, but the parents aren't. And then that is also difficult. The same way I said earlier that they'll come to the office and they're concerned, reassuring them that the medical practice is actually a very different setting than anywhere else. But, I've heard all kinds of stories, people that are driving to a hospital, for example, and they get stopped by authorities, and then they're scared because, am I going to get to the hospital or not? So these are things that we all take for granted because we don't have to think about them, but that really negatively impacts your life on every level, not only emotionally, but also physically. It can affect your physical health. So those are some of the examples. So the healthcare coverage, while it may be there for some, it may not be there to the extent where someone else may have access to better treatment and testing.
So for somebody that does not have healthcare insurance, for example, and they're relying on a free clinic to get their healthcare services, what kind of advice would you give to them if they do think that they have a food allergy, asthma, any of these conditions that an allergist treats? Are there resources that you've found to be helpful for those patients, or is there a consortium of Latino providers that is providing free services?
That's a really good question. I can only speak to our local community. So depending on where you live, finding those free clinics, sometimes they will have specialists go to those clinics, and that's where it really is most helpful. Again, I've gone to different parts of Florida where I've participated in a Saturday clinic. Maybe a church invited us to go, and we've done that. But short of that, I think that a consortium would be the most amazing things to create. So that's some food for thought.
Yeah. And I mean, of course, in those healthcare fairs, you're not going to do allergy testing, right? You're just going to provide your myth busting, your advice, and then potentially give them like a little actionable plan of maybe start with blood tests, and these are the tests that you might order, and then go from there. But it is difficult because I've worked at those health fairs too, and what you can actually accomplish feels a little bit limiting, but sometimes just the education that you can provide is at least a starting point for a lot of patients.
I really think that that's important because information, again, is power. And without knowing, okay, I need to go get further treatment or I need to get testing, they may not necessarily know that. So that little bit of information may actually be much more important than you even think.
Absolutely. And I totally agree with that.
We talked a lot about access to testing, but we didn't talk about access to medication. So if I'm having a hard time even getting diagnosed and then I get my diagnosis, what about access to an epinephrine autoinjector, or in the case of asthma, access to a rescue inhaler or a preventative inhaler? How do they navigate that if you don't have a medical insurance?
That is a great question. So one of the best things that's happened in the last few months, as many of us know, is that inhalers, for example, the cost has come down. So that is important. You still will need a prescription for them, but at least the cost has come down. It is very concerning that the lowest cost auto injectors that I know of are like $150 for two. So, and I will tell you, we have encountered that. It's hard. I've had patients where the whole family has kind of contributed to be able to purchase a 2-pack. I don't have a better answer right now for that, unfortunately, but it is a real concern. And the cost is obviously the piece that's most prohibitive for the patients to get that medication available. So I think that's something that as a society, we really need to work on, because it's something that one or two people know. This is something that we as a society need to say, this is medication that's life-saving. This is very different than something that I'm using as an elective treatment. So that's something that we need everyone's help in helping provide for these patients.
Yeah, and I think there are resources that I tell my patients about often, like GoodRx, which is a good tool. And I've never looked, but I'm assuming that they have a Spanish version of that website. But it's a place where you can go put in your zip code and the medication that you're looking for, and it'll give you different options, because surprisingly, the same medication at different pharmacies in your area might be different costs. Your doctor doesn't know. So we don't know if you're having a hard time paying for your medication. And we really do need to know that, because especially with asthma inhalers in particular, there's so many different types. And so if that one particular inhaler was too expensive, then we could try a different inhaler that will work just as well, but maybe cheaper and easier for you to afford. So that's also something that I think in different populations is even a harder conversation. As you said, it's hard for patients to bring up some of these in any cultural context. Do you think it's different in the Hispanic Latino community?
I think the whole thing about distrust, and this is in different populations, right? But especially in our population, this is where having that relationship is key because people may be embarrassed if they don't know. Let's say it's a first time visit. They're going to be embarrassed to bring up something. However, I think that's where we, especially at follow-up visits, I'll say, when does your medication expire? Show it to me. Because if someone doesn't have it, do you usually carry it? And that may be the opportunity. They may not come out with it. And then you are having difficulty, tell me why. And we can reach out to social work and see if there's any way. Because sometimes there are local programs. And like you said, there's GoodRx, there's other. But I still think that it's never enough because there's still patients that are falling through the cracks.
What steps can healthcare providers take to enhance their cultural competency and improve the quality of care that they're providing to their Hispanic patients, in particular with food allergies?
The good thing nowadays, I feel like there's more information out there for cultural competency. I'd like to just discuss like Latinos and how we are with our families, okay? So it is not unusual to walk into a room and have mom and dad, sometimes both grandparents, and aunt there. While that may seem very overwhelming for someone who's not used to it, before the pandemic, that was common day. Like we saw that all the time. And even now, we still have families that the whole room is full. And it's fun. Like for me, it's fun. This is part of our culture. Again, when you're not used to it, it can be very overwhelming because you will not just get questions from mom or dad. It's usually the tia, the aunt's going to ask a question, the grandma's going to ask a question. But this is how our culture works. So I also look at it as a positive because if we can get everybody on board, we're going to have better treatment. Somebody will follow through. If someone forgets that there's a medicine, or let's say just carrying an auto injector, there's going to be someone that was in that room that says, did you grab the auto injector? And I think that that's important. So I feel like that in and of itself, understanding that this is just how we are. It's not that they're bringing all these people because they're doubting you. This is how our culture is. And then keeping in mind the importance, when we talk about sharing information, I talked about fairs, I talked about churches, that's because these are important areas for where we find support and where Latinos in general find support. And I lump myself in that because that has also been part of my life. So it's important to remember we need to go where the patients are. They're not necessarily going to find us, but our patients are really everywhere because food allergy affects so many people. And my population really is a mix of a lot of people, as you can imagine, in Florida, but I have a very large Latino and Hispanic population. And I feel like it's Courtney, you talked about being a patient. So I'm a mom of 2 girls with severe life-threatening food allergy. And I myself was born with very severe asthma. I was in ICU early on in my life, allergic rhinitis and food allergy. So it also affects me. And I think coming from that perspective, I understand. I think the hardest hat that I wear is not as a physician or as a patient. It's as a mom. My daughter just got dropped off at college on Sunday and it's an adjustment. So keeping in mind all of these different things, and I am a Latina mom and she'll tell you I'm a Latina mom and we like to also be involved, but I think that's a positive thing, not a negative thing.
Congratulations, first off, on your daughter going to college. It's a big milestone, but I think it does take a village to raise a child. And I think that's part of what we're missing sometimes in our American culture, unfortunately. And that leads to a lot of stress and anxiety for many parents that are left to do everything on their own and don't have that support that a lot of other cultural groups have. And I think that that is important. So I definitely think that that's an asset and important. And going into that, what are the cultural beliefs and practices within the Hispanic community that might influence the management and understanding of food allergies? Because I think when you get the tias and the grandparents and everyone involved, and there's a generational involvement in the care of a child, then I think that there are lots of nuances in how people perceive food allergies in particular.
And that's an excellent question. Most of my patients are pediatric. One of the things Latinos really consider babies who are overweight healthy. So this is a big concern because when we talk about limiting a diet and we talk about avoidance, it crosses with she's too flaquita, she's too skinny. Well, that's her, but that's perceived as not healthy, right? And I guess this is where information is important because you're right. The more people get involved, the more opinions. And generationally, it's, well, my kids ate everything and nothing ever happened to them. I spent a lot of time speaking to grandparents about, you are absolutely right. Back then, we were able to, but we know that food allergy has increased. So this is where it's taking the opportunity to educate and say, all that was true back then, things have changed. And we need your help in keeping this child safe. this child's going to be able to gain weight and will thrive eating the foods that are safe for them. And I think putting it into that perspective is very important. I've seen it in my own family. I have twins. So my child with food allergy was a smaller one. What was perceived as she was healthy and the other one wasn't. And the reality is that's not true, right? We know that. But it's taking the time to educate. To say to someone, well, you don't know what you're talking about, that's invalidating. That's not fair. Back then, we didn't have as many food allergies, but now things have changed and we've learned and we can keep our child safe. And that's the way that I kind of spin it so people can understand and you can be healthy. And there's a lot of healthy options. And nowadays we have more and more options. And it's about reading labels and keeping the child healthy.
And I think we've talked about this in other episodes where we also had a mom who's Chinese and her son ended up being allergic to shellfish, and shellfish and fish and things like that are a big part of the Chinese culture. And so that made it really hard during family events. And so I can imagine if you're allergic to milk and you're a Latino Hispanic patient, I think that can be hard because milk is a big part of desserts. It's a big part of the food. And so how do you navigate that? And do you have special recipes that you refer to that keep those cultural practices kind of intact so that different events and things don't get tainted by this person not being able to enjoy them and not feel like they're a part of the cultural experience?
That's a great question. And I totally agree that giving alternatives, milk is one where it's pretty easy to substitute something for milk in a recipe. We've been seeing more and more allergy to avocado and mango, and that directly impacts our population. The good news is, I will say, most of those patients will outgrow. And a lot of times I feel like we're addressing the now, but I want to be realistic in what's the future going to look like. This may not be forever. And I think people do need to hear that. And most of the time, by the time they're older than 7, 8, for sure, they're eating both of those foods. But we're seeing increasing numbers of those, and that does affect our population. I've had patients that react to black bean or red bean, and that's really important in our diet. And again, sometimes they outgrow, and I have patients that are upper teens and 20s that haven't outgrown. So the reality there is I can't be as predictive. However, we can talk about, look, you may not be able to have this, but let's pick a different grain. Let's find an alternative. And again, having resources and recipes in Spanish, those are all things that really do help alleviate a lot of the concern, because when you're enjoying, and especially during holidays, you're all together in a family, you don't want someone to feel excluded. In my house, we actually label, because we have a lot of tree nut and peanut allergies, we label any dessert that has any tree nut or peanut so that the people know. And I specifically go to the person and I tell them, you cannot have X, Y, or Z, but you can have these other alternatives. So it's finding the alternatives for patients with food allergy. And there's a lot of great alternatives. And sometimes I tell them, I often will say, go into the kitchen with your child and let them create whatever they would like to create that's safe for them. And I've had families come back to me and say, not only did the child thrive with that, they found something they absolutely loved and everybody else loved it too. So it's creating that opportunity of, okay, you tell me, what would you like? How do you think this would taste together? And then it's magic for some people. And I think that's important.
I honestly think that that's one of the biggest tools that my parents gave me, is to say, let's give you some kitchen competency really young so that you don't feel like you're hindered by your food allergies, but actually you see all of the opportunities that exist with the food allergies that you have, because look at all of the other stuff you can eat and all of the cool things you can create. And it's not always about replacing what you can't have, but just living with what you can have. And I think that's a much more beautiful framework to live with, because you're not feeling like you are constantly limited by your food allergies.
Also, I have to mention that Courtney's mom is a chef. So she had a different experience with getting, that navigation into the kitchen. But I think that obviously all families can do that. And cooking is such a big part of so many cultural groups. And I know it's a big part of the Latino culture and the Hispanic culture. Kitchen is an important centerpiece of all of the events and activities that happen. So I think that that's great advice.
And if your mom's not a chef, it's also a good opportunity if the parent isn't, or the guardian isn't necessarily the best kitchen wizard. You can learn together, because a lot of the times when you get a food allergy diagnosis, you feel like you have to start from scratch because you can't rely on maybe packaged foods that you used to, but you have to say, okay, let's eat whole ingredients that we know are safe. So together as a family, you can learn to cook again, or learn to cook, period. And then that's empowering for everyone, right? To take on the diagnosis as a family so that you can feel like you're all empowered to help protect that person.
I think that's a great perspective.
And I know Courtney carries around these little cards that she's made. And when she travels, she has them translated in other languages. Maybe that could be a good resource also.
That's excellent. Even here in this country, right? If your primary language is Spanish, but you go to a restaurant where someone may not speak Spanish, you can just show them in English what your allergies are. I think that's a great idea.
Yeah, it's interesting because I know a lot of people in the US have both English and Spanish for restaurant cards because they just know that Spanish is so common. They'll just take it with them anyways in both languages because they want to be double safe.
And I think just the last thing to emphasize is I love talking about how useful our phones are besides just a waste of time. They can also be very useful for our healthcare and making sure that all of your important information, even that card, you can take a picture of it so that if you forget it at home, it's always on your phone because we carry our phones around wherever we go. Especially for adolescent patients like your daughter, it's an important tool because again, I know she's probably has her phone all the time. And so it's just a nice place to have all of your health information stored so that if something does happen, people are aware. We always just end with, is there any other piece of advice that you'd like to give to providers or to patients about the Hispanic community and how can better manage people in the Hispanic community with food allergies?
So I'll speak right now to the Latino or Hispanic patient who has food allergies. Again, we are affected as a family with it. And I think finding the team of people, and it's not just your medical team, but finding your support group, telling your friends, having your family understand and empowering them with information is really important. And there are many, many materials that are available in resources, and some of them will be available in the notes. But I think coming together and supporting each other, because at the end of the day, keeping one person safe keeps us all safe. And I think just having that in our minds is very important, and knowing that you're not alone. Many of us have this. And the more we learn from each other, the better we are.
Great. Thank you so much. Vivian, we really appreciate you being on the podcast and taking the time out.
No, thank you.
No, it's been my pleasure. Thank you so much.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.